Hi, and welcome to our presentation. We're presenting antiacids. I'm Caitlin.
I'm Farron.
I'm Sarah.
Rosabelle.
I'm Lois.
And we'll begin. What is this drug class used for? This is an inorganic chemicals that are used to neutralize stomach acid. It is used to relieve the symptoms of GI upset like hyperacidity associated with peptic ulcers, peptic esophagitis, gastric hyperacidity, and hiatal hernia.
Right. So the basic physical anatomy that this drug class works on, it works on the GI system, which includes the mouth, esophagus, stomach, small intestine, and large intestine. Food typically enters the mouth and is chewed, then travels through the esophagus and enters the stomach. There, gastric secretions such as hydrochloric acid containing digestive enzymes are released. They mix with the food to break it down. The food then travels through the intestines where they're continually broken down and nutrients are absorbed. And how does this drug class work? Antacids work by neutralizing the hydrochloric acid in the gastric secretions. They reduce the effect of pepsin activity while increasing bicarbonate and prostaglandin secretion. And by doing that, they restore the acid-base balance. Then we have a little video about from the Tums website, which kind of explains how this drug class works.
Our digestive system is designed to work quickly and efficiently. Gastric acids and enzymes in the stomach break down the foods we eat and kick off a process that turns what we eat into the energy we need. When the process is working as it should, the acids do their job in the stomach and stay in the stomach where they belong. But the process doesn't always work. Acid can back up from the stomach and flow up into the esophagus. When that happens, it can cause that painful burning feeling we call heartburn. Heartburn can happen when we eat certain foods, drink too much, or eat right before bed. Stress and smoking can bring it on too. The esophagus isn't designed to cope with this backup. So when gastric acid penetrates the lining, it activates nerves, setting off that painful heartburn reaction. Tums goes to work in seconds to buffer and neutralize gastric acid in the esophagus, where the pain of heartburn starts. And it keeps working as it dissolves, neutralizing excess gastric acid in the stomach, too. All this in seconds. Tums goes to work fast to relieve painful heartburn so that you can taste life every day.
Okay, this is Sarah, and I'm going to be talking about the common side effects of antacids. And because antacids has more than one component or content in it, and the most used antacid is aluminium, I'm going to be saying some of the side effects. We have constipation, mostly caused by aluminium or calcium carbonate if you're using antacids that have those contents in it, and diarrhea that mostly caused by magnesium, osteoporosis caused by aluminium if you're using antacids that has aluminium content in it, electrolyte imbalance, especially with calcium carbonate. And if calcium carbonate is used alone, it can cause the electrolyte imbalance. Belching and flatulence, mostly caused by calcium bicarbonate and sodium carbonate. And most of them also can cause kidney stones and renal complications. That is if the antacids are used for a long period of time. Thank you. And this is Sarah again. I'm gonna be reading for Rosabelle. She's having some issues right now. So I'm gonna do Rosabelle's part, that is nursing considerations. And the first thing you have to do is the assessment. And as you monitor the laboratory test results, such as serum, electrolyte levels, and renal functions tests to monitor any adverse reaction and potential alterations in excretion, and gather history, especially for allergies, and perform physical examination. Auscultate the bowel sounds to ensure GI motility and inspect the abdomen. Assess mucous membrane status for hydration and absorption. And diagnosis and care plan. As a nurse, monitor the risk of side effects such as constipation, fluid imbalance, uh, nutrition imbalance, among others, and plan for interventions. Uh, when you do implementations, consider the patient education on side effects, any signs and symptoms that comes with using the antacids. Evaluation, see if the antacids on drug therapy you have achieved its effectiveness, and how the patient responds. Thank you.
Sorry. So this is Lois. I'm gonna speaking on calcium carbonate. The therapeutic class is antacids. Pharmacologic class is calcium salts. The brand name is Tams or Tams Chewy Delights. The pharmacological action for this is it's an organic salt used as an antacid. It is a compound that acts by neutralizing hydrochloric acid in gastric secretions. Therapeutic use, it's a dietary supplement used when the amount of calcium taken in the diet is not enough. And also calcium is needed in the body for healthy bones, muscles, and heart. It has complications, which are loss of appetite, constipation, nausea, and vomiting. And the client education for this is you take as directed, or you do not take more or less of it more often than prescribed by the doctor. And when you use this medicine as a dietary supplement, take it with food. Do not swallow whole. The contraindications or precautions of this is high amount of calcium in the blood, dehydration, constipation, and decreased kidney functions. If somebody is to take this, the administration is for children 12 and older, and adults is 1 to 4 tablets by mouth when symptomatic. And maximum dose is 8,000 mg daily for up to 2 weeks. Thank you.
And these are our references, and that was our presentation. Thank you so much for watching. I hope you enjoyed it.